We have with us this evening via Zoom Dr. Johansen Sylvester, who is a general practitioner at the St. George's University. And we'd like to welcome you, Dr. Sylvester, to Doctor on Call for this evening.
Evening to the listening and viewing audience. Evening, Josanne, once again. And thank you for inviting me to speak on this day, on this very important topic.
Okay, so before we get into the day itself, maybe you can give us a little background, Dr. Sylvester, on yourself and your work at SGU.
I'll be glad to. I am a general practitioner of 20 plus years experience, and I currently work at university in the capacity as clinical assistant professor. There I see patients on a daily basis, but my secondary role is that of the director of the SGU's visiting cardiology program. And for approximately 13 years now.
Okay. Thank you for that little introduction there. Today is World Heart Day. What is the significance of the day, though? World Heart Day, every 29th of September. And from my research, I see that this has been observed for quite a number of years. What happens really on World Heart Day?
What happens every day? Doctors, nurses, the healthcare system pays special attention to heart disease every day. But on September 29th, in particular, work to mark this 24-hour period so that we can make the public more aware of heart disease and the effects on individuals and greater society. This year in particular, we, as we are living in unprecedented times, and as such, we have to address the with a little bit more sensitivity and awareness are more vulnerable to cardiovascular disease. So using this particular platform and media, my hope is to address or to help make more awareness of cardiovascular disease, complications, and how to mitigate these problems, especially in the vulnerable sector for those who are more at risk of developing complications of cardiovascular disease secondary to COVID-19 in particular.
Okay, so I see that you have the theme there displayed right there with you today as World Heart Day. Use heart for society, your loved ones, and you. Can you talk to us about the theme? Use the heart to beat. Talk about the theme.
Okay, so the World Heart Federation has decided this year that it's going to use this particular theme and certain hashtags that run along. Use the heart for caring, use the heart for developing certain societal awareness, behavioral changes. So we're using the heart, meaning we're going to use our heart, we're going to use our influence, we're going to use more compassion to address these in a way that we treat, which is always good and compassionate, but we're going to emphasize more on that, not just to have knowledge of, not to with some degree of empathy, but to show more compassion to those that are more vulnerable. And that is important. In particular, we have a communicable disease, which is the novel coronavirus, COVID-19, affecting this subset of our population, which cardiovascular falls under, and that is a non-communicable disease. So cardiovascular one of several non-communicable diseases. But we know that the elderly are disproportionately affected or fall ill to the effects of cardiovascular disease more than any other group. So knowing this, we have to try to prevent them from being affected or infected, in this case, by COVID-19.
So you mentioned the elderly. Are there any other groups that are more vulnerable, especially now that we are experiencing the COVID-19 pandemic?
Yes. The other vulnerable groups that would fall under that non-communicable cardiovascular group would be those with pre-existing high blood pressure or hypertension, those that have congestive heart failure, sometimes called CCF, those that are diabetic, type 1, type 2, independent non-insulin, those that have pre-existing heart valve problems, in particular those that have rheumatic fever, those that have acute coronary syndromes, who have had previous, let's say, heart attacks, those who have strokes. These are the ones that are more vulnerable to getting the effects or to suffer more severe effects of COVID-19. Now, mind you, COVID-19 is primarily a respiratory disease, or a disease that affects the respiratory system more than the other organs. But what we've seen throughout the media, throughout the use or the mediums that we use to do our research and to keep up to date, is that it is a multi-organ problem that causes systemic inflammation. So every organ can be affected: the heart, the lung, brains, the kidneys, and so forth. So we have to pay attention to all of this and to know that all of these organs, they function as a system, not in isolation. So every discipline, every specialty has to be addressed, in particular respiratory system, cardiac, renal, so forth. The purpose of this day is to draw special attention to the heart and its associated vasculature, so namely the brain and the blood vessels that support each one of these.
Okay, so I guess it's a good time to ask you to maybe talk to us a little bit about the functions of the heart. Of course, when we talk about the heart, I mean, most people would know that it pumps blood around the body, and maybe it stops there. But maybe you can explain to us the other functions, important functions of the heart.
Okay. In summary, the heart is a very important body. Sometimes people want to categorize which one is more important than the other. But the heart is basically a muscle. It's a mechanical muscle that starts from anywhere from 4 to 6 weeks from conception until your circulation stops at your death. And it never stops beating during that period of time. So its primary purpose is to be a conduit and a pump through which blood is moved through the body. If it receives blood one side, it's deoxygenated, then it pumps it to the other side, so to speak, through your lungs and again, and then your brain, your kidneys, every which way. So this is controlled by valves and an electronic system that is pretty sophisticated. And that's what the heart does. Okay? So it's an integral part of the cardiovascular system. We can't do without it. And we need to maintain it and take care of it, because we only get one. Okay, we only have one life, one version of this. Okay.
I like that. So how do we keep our hearts healthy?
All right, good question. Okay. So you are born, and you can't choose your parents. Genetically, you are given gene from your parents, and you are born with a healthy heart. Some people, unfortunately, have congenital problems, and that has to be addressed early on in life, and hopefully they can have a good quality of life from that time on. So, as adults, the thing that we have to look at and say, well, how do we prevent or premature heart disease? And that is heart disease before the age of 70, 75, is by looking at the risk factors that affect heart disease. And the most commonly accepted trilogy for that would be hypertension or high blood pressure, high cholesterol, and diabetes. So today we have these three things acting individually or in concert with each other, and sometimes promoting accelerated cardiovascular disease at an early age. So these are the things that we have to address. Now, we have other factors that influence it, such as your diet, lifestyle changes. And these are things that I spend an inordinate amount of time with my patients to educate them on, because these modifiable or behavioral things are the things that we can change. We can't change makeup. We can't change our predisposition sometimes to developing hypertension or diabetes or even dyslipidemia, but we can modify our behavior. We can decide what to ingest, how much to ingest, the quality of food, the exercise that we partake of, whether we smoke or we don't, whether we drink strong intoxicating spirits or alcohol, or how much. So these are the things that we can address, be seen as a modifiable risk factor for heart disease. Okay, quality of air could be, especially if you're doing secondhand sleep. Okay, so we address these things individually, but these are the things that I would like to probably get a bit also. And last but not least, I would probably want to talk about mental health, how that affects your cardiac or cardiovascular risk stratification. So at this time in particular, the last 6 to 7 months, we've seen the effects of COVID-19 on the world. We've seen the dynamics that it's caused us to have to adapt to. And also, we've seen and heard about the stresses of COVID-19 on the immune system and cardiovascular system, from anxiety to depression and everything in between. So these things can affect the heart. These things can affect your morbidity and, unfortunately, your mortality. And it's not something, the latter, it's not something you can measure, with the barometer very well, how stressed you are. But stress hormones and cytokines in the system can affect your caliber, affect the way you feel and the way you react to changes around you. So stress is a significant mitigating cardiovascular factor, especially today.
Okay, you broke up there just for a little minute. So you are saying that there is a relation, stress and heart disease, or strain on the heart because of stress. And you spoke about the situation that we are faced here now with COVID-19, and that must have added pressure to a lot of people, or added stress to their lives. So how do we manage stress? So it seems that it's a problem. So how do we go about managing stress? And also, you mentioned diet, exercise. What sort of balance here that we need to ensure that we remain healthy?
Okay. I would like to probably address that question in the reverse order. When I spend time with patients. I spent probably more time talking about mitigating dietary changes, lifestyle, what they eat, exercise more than probably their mental health. Sometimes I have to refer to someone who's more qualified to do that. Okay. But I will tell you first and foremost, there's a you are what you eat. You are what you eat. Okay? You are what you even look at, so to speak. It helps make or it helps develop your personal character and your well-being. So what we put into our mouth, what our gut or GI tract assimilates, helps make the building block for our cells and our tissue. So just like in the software computer industry, if you're a programmer, you know that if you write bad software, you will get program garbage out. So when you put harmful substances into your body, the blocks they're going to be more vulnerable to infection, to mutagenic changes of cancer, etc. So what we have to do is understand that we need to eat more healthy diets. We need to eat more fresh fruits and vegetables, at least 4 to 5 servings a day. You heard during the early part of COVID response by our CMO that we need to eat what we grow, do what we eat. Okay, we need to eat more local where possible. We need to also drink more water, more pure water. We need to consume water in our body size and so forth. Okay, I drink at least 2 liters a day. We need to cut down on consumption of very sugary drinks, in particular soft drinks. And if you do, more sugar than they need to. So if you're drinking juices, maybe the unsweetened version, or you can just eat the fresh fruit. Reduce your caffeine intake, reduce your soft drink intake. Soft drinks contain a lot of phosphates, phosphoric acid, which damages your kidney. And those that have pre-existing renal conditions or kidney disease are more vulnerable to that effect. So that's a group that aware can be affected by COVID-19 and dietary things. So eating less processed and pre-packaged foods, rich in nitrates and nitrites that help preserve them. As you're aware, when you buy a sausage or sausage in the packet in the grocery supermarket, it's usually red, deep red color. That's not the natural color of some of the meats. The chickens are not red meats. So the nitrites are there to preserve it, and things are going to be carcinogenic and cause problems and your heart indirectly. So eating less of these processed foods, eating more fresh fruits and vegetables, more water, etc., more grains and beans and pulses and so forth. These are things that are more beneficial, especially at this time of the year. We have avocado is abundant. That is a food that is good for the heart. That's a good type of fat in it. And you can substitute that for your regular butter or margarine and the other versions of fat that you will get in the supermarket in the containers. So these are the things I would like to emphasize. Alcohol is maybe a touchy subject for some. They are recommended, depending on where you live, what country you practice, how much alcohol that should be consumed by adult male and females. I advocate 0 alcohol. People can fight me on that, but I believe that it is not beneficial in any way, and there are an inordinate amount of documents that show it. So more so than the wine or alcohol is cardioprotective, but in the long term it does more harm than good. So I do not advocate drinking. I do not advocate smoking small amounts. Smoking causes accelerated degradation of vessel epithelium. It causes accelerated heart disease. It causes sudden cardiac death, especially in young people. And I can talk forever about smoking and the benefits of quitting smoking, which can be felt even within a few days after quitting smoking. So these are the things that we need to probably address individually and as a family sometimes, among ones and at the community level, how we influence those that we act with in the workplace, and also I would say at the governmental level to see how we can continue to address the healthcare dilemma that we are constantly facing. Health sector is all to address this problem of cardiovascular disease. Worldwide, cardiovascular disease kills approximately 18 million people annually. And more so in lesser developed countries, small and developing states such as ours, yes, the 80% of our adult deaths between the age of 30 to 70 years comes from cardiovascular disease. So we have to emphasize this strongly, so we don't have the premature death, but the knock-on effect of the economic burden, where we have younger people dying much sooner than they should, so to speak.
Specific to Grenada, Dr. Sylvester, who would you say is more at risk in Grenada, men or women, of suffering from heart disease? What is it that the statistics are showing?
All right. I don't have exact statistics to give you on that point today, but it's a valid question, and the statistic itself generally will probably enough. Men always succumb to cardiovascular disease more than women, especially in Grenada. It hasn't changed over the number of years that I've been keeping the data, or what we're looking at the data, and I'm sure Dr. Sean Charles could support me on that. Women have a fair amount of cardio protection up until maybe the age of 55, 60, around menopause, because of a higher level of the system. But as they hit 60, their risk factors start to equal that of a man. And we find today that because of lifestyle changes, because of, probably women, smoking more, drinking more, because of sometimes our lifestyles, we're staying up late at night, etc. People are working 2 shifts, people are, parents at home, several kids. Their risk factors have also changed, and we find that women are now succumbing a little earlier than previous years to cardiovascular complications. And when I say cardiovascular complications, I'm not just talking about heart attacks, but stroke, vascular bleeds in the brain, or what we call ischemic strokes, where there are blockages in the blood, the blood supply. So men still have a higher degree of mortality than women, but are trying to catch up. So it's unfortunate that we have these changes, but it is something that we can still, and that is something that I especially to the young, those in the primary schools and in high school, because from a very early age, the vascular changes that lead to narrowing of the coronary and plaque buildup starts from a very young age. Those kids in school have plaques in their arterial system. They're not symptomatic or aware of it, or complain of infection, etc., or have obviously high blood pressure as yet. But we've seen throughout the world that the risk factors are the same for kids. So the hypertension, the diabetes, in particular, what we call diabetes, is a significant problem in young kids in primary school. So, people with higher body mass index, especially if you have truncal obesity, and that's where the weight is around the tummy area, that is a risk factor. We're seeing a lot of kids in primary and high school showing these characteristics and at risk. So, these are the things that we have to try to address at a very early age. Definitely in our society, having almost equal number of mortality statistics in the future compared to men.
Okay. We're talking to Dr. Johansen Sylvester, General Practitioner at the St. George's University. It's Doctor on Call for today, Tuesday. Stay with us. We will be back with more after this break. You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
Reading is too hard. Reading school books is lame. I'd rather read about children like me and cool things. I can read, but sometimes I don't even know why I have to. It makes no sense.
Why can't we read about things we like?
Reading is the key to unlocking all learning and ensuring that children reach their potential. Here's what the children have to say.
Make reading fun.
Teach me how to read, but let me practice reading with things I like to read. Talk with me and read with me at least for a short time every day.
Let me tell you my own stories.
Read, learn, grow. The children are the future. Help them read, learn, grow. So parents, you play your part.
This message is brought to you by the OECS USAID Early Learners Program, funded by United States Agency for International Development.
Welcome back to Doctor on Call right here on K105 and also on GBN Television. And we invite your calls. You can dial 435-2041 if you have a question for Dr. Johansen Sylvester. We're talking about maintaining a healthy heart, and especially now that we are today observing World Heart Day. Dr. Sylvester, welcome back to the program. Dr. Sylvester?
Can you hear me?
Okay, I'm hearing you now. So we were talking about who is most at risk when it comes to heart disease. Can we continue now to talk about some of the common conditions that you see affecting people here in Grenada?
Okay, I briefly highlight some of the common conditions that we normally see are hypertension or high blood pressure, diabetes mellitus, high cholesterol or dyslipidemia, and things which can lead to congestive heart failure. So I think that practice under the cardiovascular disease umbrella.
Okay. We did invite callers, and I believe we have our very first caller on the line with us. Let's take the call. Hello, good evening, and welcome to Doctor on Call.
Hello?
Yes, good evening. You're live on Doctor on Call. Go right ahead, please.
Yes, good evening. I heard the doctor talk about red meat. I didn't hear him clearly. Apparently his audio was not functioning properly. But I would like to know, besides beef, what other type of red meat we got, and what, some people like the meat medium rare, while some like it well done. What effect it has on the heart?
Thank you for your call. Dr. Sylvester?
So in summary, I think the caller was asking about the effect of red meat on the heart.
Yes.
And I think there's a second part of that question. I think the audio was dropping.
So she wanted to know, when it comes to preparing the meat, what is best?
Well, I would first of all tell you that a diet that is not primarily focused on meat, or as a basic, people, better than one that has more, meat. Now, what I'm trying to qualify is that I would have more of a vegetarian or pescatarian diet than one that would consume in particular red meat. So, in answering that question, I would not, I would say if you were to consume red meat, then you should do cooked and well prepared. The consumption of meat and products either and highly debatable science and nutritional concern, but our gastrointestinal tract changes as we get older, and we find that more meat is often slightly on the processed meat. You are more vulnerable to the effect of some of the unwanted pathogens, in particular some parasites, bacteria, and something that concentrate or contain. So we do find that a more plant-based diet is more healthy, and that patients that have cardiovascular disease, established cardiovascular disease, actually improve or get better when they eat. And in my practice, I tend to promote fruits and beans and legumes at, let's say, 50% of the plate. The meat portion maybe as much as 25%, and your carbohydrates the other 25%. So I'm not trying to advocate, that you go cold turkey and become a vegetarian overnight. But I would strongly advise because to prepare the meat well, it is that you're eating, beef or pork and so forth. There's well the harmful effect of these meats on the human system. They do not directly cause injury to the heart. Okay, you are what you eat. So the things that these meats consist of are being broken down and building blocks to make new cells and tissues for your body. So if you want to have a healthier heart, you need to incorporate things that will give you a better chance of getting, these substrates. Meat is not the preferred nutritional component if you want to eat your heart. Okay, you can eat it. You can probably live a long time eating meat. Some people eat more meat than vegetables, and they can say their grandparents by doing so. But with the added stresses and factors of today's life, if you want to get an advantage, forward with a greater chance of living longer, then you need to look at this well-established a breakdown in your genetic makeup over time. So these things can make your cells in your tissues to be more at risk of cases when cancer changes. So we can talk about colonic cancer, we can talk about disease of the liver and so forth. Probably slightly tangential to the world heart. I'm happy to address that another time, okay? But yeah,
Okay, I hope that caller heard you there clearly. We have another caller on the line. Hello, good evening, and welcome to Doctor on Call.
Good evening. Good evening, Doctor. The phone is a bit too loud. Sorry about that. That's better. Yeah. Hello?
You can go right ahead, sir.
Right. Okay. I know we're discussing the heart tonight, right? The problems concerning the heart and heart disease and so on, right? But I just want to ask, please, right? I just want to know something here tonight. Is the wearing of the mask, right? Is the wearing of the mask have any effect on the immune system? Please, if you could tell me, if I could know, something concerning that, please. If there's any, if the wearing of the mask, cause any effect, cause any harmful effect on your immune system. Yeah, I just want on that, please. Thank you.
Thank you very much, caller. Dr. Sylvester? Wearing of mask?
Wearing of mask. And I don't want to contradict any response or information put out by the Ministry of Health concerning this matter, because this has been addressed before. The effect of wearing a mask, and let's say this is a generic mask, you're using a soft mask per se, does not negatively affect the immune system in any way. Okay, now the immune system works, not just separating apart, but in a slightly different way to the cardiovascular system. People have had concerns about the rebreathing of carbon dioxide by individuals, and in particular those that are more vulnerable, those that have obstructive airway disease or asthma, etc., or liver kids, and other subgroups that have difficulty keeping a mask on for prolonged periods of time, go to the system, lung disease, and cardiac function. But putting those aside, the general population would benefit more significantly by wearing a mask than not. So the amount of carbon dioxide that you newly breathe is not significant enough to make you unwell or to compromise the immune system, even if it's 5-10 minutes. So I would strongly promote, especially in close proximity to others, especially unknown and tested, etc. Please wear your face mask appropriately. Cover your nose and your mouth, etc. Okay, we can have a separate discussion about wearing face masks and COVID-19. But no, the answer to that question, it does not affect your immune system in any negative way by you wearing a standard cough mask or an N95 or any of the particulate respirators will not affect you in any significant way.
We have another caller on the line with us. Good evening and welcome to Doctor on Call.
Yes, good evening again. I'm the first caller. There was a second part of the question which I had asked, and apparently the doctor heard it, but he didn't express it. The problem I asked was that beside beef, which I know is red meat, what other type of meat is classified as red meat?
Thank you, caller.
Right. I'm afraid that the question, the answer probably, the caller probably even knows the answer to this. Regardless of what, but I am not one to normally classify meat as being red or white. It doesn't really even make a difference. You have different types of even steaks that can be classified as red and white and so forth. So, the point is, it's not a matter of, how do you call meat red if it's, it's pork or, primarily a red meat or white meat or turkey or chicken and so forth. The processes that are used to prolong the life of meat in packages and skins and so forth are primarily what is the more significant point. The nitrogenous compounds and so forth that are used in addition to the pickling or salting of food, etc., is what has been proven to be more harmful to some people over a certain period of time.
I hope that answered her question. So we're talking about healthy hearts and on World Heart Day, that is. And Dr. Sylvester, earlier on you mentioned a bit about cholesterol, and that's a very common thing we hear about. Can you talk to us a little bit about the link between cholesterol and heart disease?
Okay, very good question. Cholesterol is, it's part of the normal makeup of your cell architecture, your cell wall. Every cell, every tissue in your body is made up of cholesterol, just like a room is made of blocks and mortar. And you need it for normal cell integrity and communication. Your body makes as much as 75% of the total cholesterol that you may see in any blood test result. Okay, your liver in particular makes most of this cholesterol, especially at this time of the day, in the evening time. So cholesterol is needed by us. It's needed by the body, it's needed by your cells and your circulatory system. But what we do find is that some people are more at risk of developing a higher level of cholesterol than the body can appreciate and metabolize appropriately. So these people have what's called high cholesterol. Some people do have low cholesterol, on the other hand, but most people have probably normal or high cholesterol. More so, we find that the bad cholesterol, as we commonly call them, the LDL, the VLDL, we call them the low density and very low density lipoproteins, and the triglycerides, these things can accumulate, and over time, along with other blood products, get together and form a little, network, like a little clot within the blood vessels. Now, blood vessels are various caliber of sizes, and it doesn't take much to obstruct or obscure the passage of blood through, let's say, the coronary arteries of your heart. So having higher levels of cholesterol puts you at greater risk of developing these, what we call atherosclerotic plaque. So just like an old pipe in a house, if you were to cut open an old iron pipe in a house that was, let's say, pre-Janet, you will find that it's all gunked up. The water flow is not going to be good to it. And in cardiovascular disease, it's a demand versus supply issue. So as your demand goes up, if your workload goes up, if your oxygen consumption goes up, then you have to be able to meet that demand with blood. And if it can't pass through those narrowed arteries, then we're going to have a problem. And that's when you start getting chest pain and so forth. So high levels of cholesterol would cause these plaques to build up in places you don't want them to build up, or as fast as you don't want them to build up. The cholesterol that we're talking about, the bad cholesterol, most of it would come from your diet, okay? And more so, your meat products, okay? So, again, getting back to that animal discussion, okay? You're not going to get it from eating plants and vegetables and so forth, even though there are some plants that have cholesterol. Plants, avocados have a good source of fat. Okay? Peanuts have a good source of fat, etc. So, the foods that contain a higher level of cholesterol would be the meat. In particular, let's say your seafood, okay, your lamb, lobster, shrimp, etc., the conch, whatever you like to eat. When I say seafood, I don't mean just fish, but more so those shell foods than, let's say your marlin, mahi, snapper, etc. Right? So these other type of seafood contain a disproportionately high level of cholesterol. In addition to other things, there are other toxins that they also concentrate. Okay? So I vehemently try to convince people not to eat these types of foods in proportion or in compared to eating more healthier seafood, such as fish, okay? Such as other fishes. Some of these creatures are what we call benthic feeders. They're scavengers, and they're at the bottom of the food chain. So you are eating what they ate, and they ate what fell to the floor of the sea, the ocean, or even of the riverbed sometimes. So you don't want to be eating literally cockroaches of the sea, so to speak. So I would usually tell people these things contain a higher percentage of bad cholesterol compared to other sea creatures. But getting back to the land creatures, you do find that in even very innocent looking chicken, the chicken wings are highly fatty. And if you think you're just going to fry up a few wings and have it as opposed to a big chicken leg or a barbecue, you may be misled by the amount of fat that it contains. So, chicken, beef, pork, turkey, all these things contain a certain percentage of fat. But you can reduce that cholesterol risk by your preparation method, by removing the skin off the chicken, by the method in which you prepare it, if you're baking as opposed to frying, or if you're steaming as opposed to stewing, etc. That's a preferred method of reducing your unwanted harmful fat, and therefore reducing your cholesterol levels. But as I said, some people are at a greater risk to develop a resistance for high cholesterol. And some people I have patients that are on medication for high cholesterol that are vegetarian, and they're exceptions. Okay, that's not the norm. So you can develop it even if you are vegetarian. But the usual pathway is through the mouth that most people are going to trouble with their cholesterol level.
Okay. It's Doctor on Call, and we will be back in just a moment.
Hills and Valley Med Care Center, located on Grenville Street, St. George's, has a highly professional team that gives excellent service in massage therapy, physiotherapy, speech therapy, medical consultation, and more. Hills and Valley Med Care Center sells a wide range of medical supplies, offers home visits for patients in Grenada and Carrier Crew, and opens Monday to Saturday, 10 a.m. through to 7 p.m. Visit or call Hills and Valley Med Care Center today, 435-6904.
How going on, boy?
Hey, good old things.
Hey, Daisy.
Yeah.
Boy, in line, boy. Your house looking a real good day.
Boy, it's thanks to the hard-working and professional staff at the Housing Authority of Grenada. They handled me real nice. They did my plan, they did the construction, and I didn't even have to worry about a thing. They were there with me every step of it, supervising the job, asking me about my concerns, giving me feedback as the house took shape. They were there from start to finish, and even put the keys in the palm of my hand. I give them an A++ for customer service.
Oh, it's people from housing bad, boy.
Boy, not bad. Excellent. If you're thinking about constructing your home, why not consult the Housing Authority of Grenada? You could visit them right down in the Sandino complex, or give them a call, 440-1015 or 440-1016. Or check out their website, hag473.com. They go handle you. They go jog your blocks, they go draw your plan, they go tote your materials. Hey man, where you going? The Housing Authority of Grenada is your choice for affordable housing and a stress-free construction experience.
You're already ill and have no time or energy to walk every which way to access your healthcare needs. So come to Spice Isle Imaging on the Carenage for a one-spot stop for all your health service needs. See our in-house doctor and get your meds from the pharmacy right on location. Digital X-ray, MRI, CT scans, mammography, ultrasound, and laboratory services are also available. So for that moment when life makes demands on you, you can make demands on us. Visit us at Spice Isle Imaging, Carenage, St. George's. Welcome back to Doctor on Call, and it's World Heart Day today, and we're learning more about the heart, how to keep it healthy, some of the conditions associated with the heart, risk factors, and helping us to understand all of this is Dr. Johansen Sylvester, who is a general practitioner at the St. George's University. Welcome back, Doctor. As soon as we're back, we have a caller on the line, so let's go straight to that call. Good evening and welcome to Doctor on Call.
Night. Hello.
Yes, hello, good night. Go right ahead, please.
I'm pretty okay myself. No, doctor is talking about heart in any case, you know. But all the time, doctor tell the nation about water important, eh? A lot of people think we doesn't drink much water for the body to function properly. Water, they drink more. Some of them drink a lot of beers instead. That's alcohol, less water. They drink juice and malt and all different things and less water. Let them know that water is important for the body, and the amount of water the bone take, what they drink for the day. In any case, you know, how much pints of water is we drink a day, in any case, and how important water is for the body. So meat is compulsory for man to eat meat. Pork and beef and thing, all them things. Man must eat them things and ham and things. It's compulsory, doctor. Salt and sugar.
Thank you, caller. I think Dr. Sylvester spoke about the meat, consuming meat. Doctor, you want to weigh in on this caller?
Okay, I think the first part of his question, can you hear me well?
Yes, go right ahead.
Okay, I often say practice what you preach. And I don't want to advertise while I'm doing that, okay? Your body is made up
as much as 70 to 75% by volume of water. Okay, so if you take the average 70 kilogram man, you're looking at least 49, 50 kilograms of him is made up of water. Okay, so your cells, their composition, their organelles, the things that make them work, are bathed in water, so to speak. Okay, your blood vessels, the blood itself, the red cells, the white cells, etc., are moving in a plasma. They're moving in a liquid medium that is mostly water. So we definitely need water. Okay, you can probably live as much as 30 days without food, but you probably can't live 3 days without water. Okay, so you need to drink. You need to drink in proportion to your body weight or circumstances. We know that depending on certain medical conditions, people with certain heart conditions, people with certain kidney conditions in particular, have to limit the volume of water that they consume every day. And that's a very case and tailored problem that we may have. But generally, you need to drink at least 2 to 2.5 liters of water per day. I strongly advocate drinking water that is at room temperature and not cold.
And why is that important?
Well, to begin with, your body itself operates optimally at a certain temperature. Your body's cellular makeup, its enzymes are activated and deactivated based on a certain temperature distribution. And optimally, you're looking at, let's say, 37 to 40 degrees Fahrenheit. Why would you now consume something out of the freezer with ice that is maybe at 5 degrees or even lower, freezing, and bring it into your body and expect it to perform miracles? Because your body is now going to have to warm it up. It's going to use a lot more energy, and in the process, it's going to lose a lot of the value even of the food that you've ingested before that, because you've now kind of frozen these molecules, you've broken it down, you've interfered with assimilation and absorption of food in that way. So you're going to have a lot of nutritional malabsorption issues. Okay, so people find that they get cramping. It's almost the same as drinking something that is caustic. The extremes of temperature are never advised. So very cold water, very cold soft drinks, likewise hot water, okay, or very hot beverages are not the best thing for your body, in particular the epithelium. It's the cells that line your mouth, your esophagus, your stomach, are the first ones to get introduced to these things, and you can burn them just the same as you would burn your outer skin if you were to drop hot water onto it. Parents who are, who've had kids, mothers, fathers, caregivers who've taken care of babies would know that if you're feeding a baby a formula with, water or milk or whatever, you test it first on your skin sometimes before you give the baby. And I tell grown-ups that, I said, if it is that this tea that you are about to consume is too hot to give to your child, you shouldn't drink it. Okay? Especially if you feel steam coming out of it and you kind of sip and put it down and sip again or blow, and then eventually you start causing changes in the cellular makeup, and sometimes predispose you to developing cancer in these areas, and that's a well-established fact. So drinking extremely hot beverages, it's like drinking a toxic substance. So I would strongly advocate when you get up in the morning, you drink at least a glass or two of room temperature water. First thing in the morning, and before you go to bed, the last beverage should be water. Even if you had tea or something, then you drink some water, maybe a half a cup of water before you retire. and throughout the day. So there's a proportion to your needs, especially if it's very hot. September is invariably the hottest month of the year, and no one can be beating on that this year. Daily temperatures are 34, 35 degrees in some cases. So there's insensible losses that take place when just talking, breathing, through respiration. And if you're outside, you lose a lot more. If you're in air conditioning environment, that is probably underappreciated, but you do lose a lot of water, just being in a very cold room. So you need to replace what you lose, but I would always advocate trying to top up, so to speak, even before you lose it, because physiologically your body is a bit slow in telling you that you're thirsty. So you can't rely on those indicators for thirst. You don't say, well, my lips are parched and I feel really dry and I'm a bit lethargic and sleepy or whatever, then to go and drink. That's a bit, that means your body was dehydrated or dry many hours before. Okay, it's the same for hunger and also for even sleep. Okay, you shouldn't wait until your tummy hurts you and you're almost collapsing on yourself to say, well, I need to eat something or I need to go to bed. So you need to stay ahead of the physiological demand. You need to drink throughout the day. Drink that glass every other hour or so if you're at work. I usually carry a 1.5 liter bottle of water to work, and I consume that while I'm there. Some before and some after. But when you do that, you actually not just will feel healthier, you will feel stronger, more alert, and so forth, but it will also serve as a very affordable mitigating method to reduce your blood pressure, to reduce your cholesterol, to reduce your sugar. For those that are diabetic, it's a natural way of doing it. It doesn't cost you anything much to do that. Okay? So this whole problem that we have with hypertension, that is also another pandemic on its own, can be improved by drinking more water. Okay, and on the other things that we can talk about, like increasing exercise and salt reduction, etc. But I kind of overemphasize this. It's on a list of things I normally speak about. It's number one on my list, always drink more water. Other than your first urine in the morning, maybe slightly concentrated or a bit for color or so. The other urinary colors that you will see throughout the day should be almost colorless. Okay? We don't want it to be clear, crystal clear as this, but maybe close to this color, thereabout. Okay? So just want to emphasize that point for you, for the fall in particular, and it's a very good question and point that we should emphasize.
The importance of water. We'll take our final call. Good morning, good afternoon, good evening, and welcome to Doctor on Call.
Good night. Good night, doctor. For past maybe a year and a half, almost 2 years now, I've been having an irregular heartbeat, and it would last about 15 minutes. My chest will hurt, and then after when the irregular heartbeat goes away, and my head will feel light. Could you shed some light on why it's doing that?
Okay, thank you, caller.
I think I got most of that question from that caller. I think she says that she gets an irregular heartbeat from time to time, and she's been getting it now for a number of years. Am I correct?
I believe so.
Okay, and when she experiences that, or those episodes, or after she feels a bit lightheaded.
I think she did say something about for about 15 minutes.
Right. Now, my advice to you is that you should have seek medical attention after the first one. Okay. I cannot tell you off the top of, what caused that, but irregular heartbeat, sometimes people say I have palpitations. Some people use the word flutter, and they use other terminology that may be known to them to describe to us physicians that they felt that something was a bit different. I felt as though my heart stopped, they may say, or I felt as though it's a beat or more. That itself, in terms of the heart stopping, is probably less likely or not likely. But if it did stop for at least, let's say, more than 4 or 5 seconds, you would completely pass out. More commonly, people experience what we call premature beats or premature contractions of the heart. Sometimes it's the upper chamber or the atrium or the lower ventricles that do that. More commonly, the lower chamber. And the terminology we use is PVC, premature ventricular complexes. Fancy term, but basically it means that one of the heartbeats came a little before its designated time. Okay? So the heart may be beating fairly regularly, and then for some reason it introduced the beat little before its scheduled programming, so to speak. Okay? And sometimes people take note of that. They feel it. If it is that you feel unwell after, then it warrants a visit to your doctor's office or the emergency department. And I strongly advocate that we utilize these services appropriately. Okay? As I said, cardiovascular disease is the leading cause of death worldwide. Okay? And as much as 30% of mortality worldwide is because of cardiovascular disease. So irregular heartbeats, or sometimes what we call arrhythmias, can be a sign that something is not quite right with the heart. Your doctor would know what to do. The appropriate investigation will be done at casualty department. If you go and you give them that history, they will not turn you away. Okay, so they will do an ECG, next called an EKG. Blood test could be done at that time also to rule out any coronary event. If you've been having it over several months or years, they need to investigate heart muscle disease and do a number of things. And I don't want to give you a long shopping list for you to go and Google it, per se. But sometimes it may just be a very benign thing to some people, especially if they are dehydrated. And one of the most common causes of an irregular heartbeat is dehydration. The second most common cause in our setting would be probably anxiety at this time of the year, in the last 6 to 7 months. Anxiety and stress and exhaustion can cause your heart to beat irregularly. Okay? More so during COVID, cardiologists are probably seeing more of these arrhythmias or abnormal heartbeats because of the way in which the COVID-19 virus directly interferes with the heart muscle. Okay? So it's something that cardiologists are aware of as COVID-19 affects the heart. So that's why during this day we are trying to emphasize more on being aware or making loved ones aware and society aware of the vulnerable, those that see existing cardiovascular problems. So if you've had a heart attack before, then you're more at risk of not just another heart attack, but the effects of COVID-19. So arrhythmias are things that we take very seriously, and the caller should seek medical attention by a suitably qualified physician to address this concern.
Okay. Are there other signs, though, other than the fluttering of the heart that you spoke of, that may indicate that you have a heart condition?
Yes. The more common scenario or symptom would be that of testing. Okay, so we assume that angina. Patients may describe a discomfort in their chest, even sometimes central, sometimes a little bit to the left, sometimes even in the what we call the epigastrium, which is like the tummy area here, where the stomach would be. We see that more in women and in diabetic patients. It's a kind of an atypical presentation. So it may not always be classically your clenched part, holding here and pain in your jaw and your arm. Sometimes people get pain in their back, depending on what part of the heart is involved. But this is one of the more classical symptoms that that patients get. They get a discomfort, a heaviness, sometimes with difficulty breathing, shortness of breath on exertion, sometimes shortness of breath at rest, difficulty in completing a sentence, sometimes nauseousness, feeling unwell. We use the terminology here, sometimes people get a bad feeling. You've heard that before, right? Everyone said, I get a bad feeling when they start sweating and something is not right. And that's a sign that they need medical attention. Sometimes they may just throw up with it, they may vomit. We use chest pain and we need certain medical attention to do that. So, heart disease is no joke, and we need to take loved ones seriously. Regardless of the age these days, we see people having very early cardiovascular problems in the 20s and the 30s, more so than ever before. And we've seen that in particular during this period of COVID, where people are getting other heart disease, but vascular bleeds and strokes and so forth, blood clots, more than prior to this particular period of time. So these are the things I think we should emphasize more: the chest discomfort, the angina type of complaint, or even difficulty lying flat on your bed without a pillow. If you have to pick up with 2 or 3 pillows, or in the middle of the night, they're always going to the windows to get some fresh air because they just can't breathe. Suddenly they short of breath, they're gasping for air all the time. These are common signs, and they warrant further medical evaluation and diagnosis.
Thank you very much, Dr. Sylvester. It's just about time for us to wrap up the program this evening. Before we go, though, is there anything you'd like to share with our listeners?
I just want everyone to be aware of their role personally in improving their heart health. They can do that and also share that awareness to their family members and friends. We do have a role at the level of civic society, of business. Businesses can be more responsible for their employees and their workers to make sure that they get their checkups and just to make sure that they're okay in that respect. Government will continue to do this job, and they've done a solid job, I think, in mitigating the COVID-19 problem that we have at the pandemic. But we can probably work on certain initiatives and policies that will improve, or improve health outcomes. We may talk about taxes and certain things that can be introduced, and probably taxing is a bad word, and I don't want to get into politics, but we have to find a way of discouraging people from consuming things that are harmful to themselves. And we find that the use of lots of refined sugars, we find the use of lots of salt added to food. We find that the overconsumption of intoxicating spirits and alcohol. We find that the use of tobacco, first-hand and second-hand, directly contributes to accelerated cardiovascular problems. Okay? So if we can encourage people from harming themselves, if we can encourage good behavioral practices, then we can fight cardiovascular disease much easier. Okay? And it doesn't cost more to stop doing harmful things to yourself. Okay? So I would encourage people, I discourage strongly, adding salt to your food. I never add salt to my food. I don't think that salt shaker belongs on the table. People go to certain places, they buy a box of food of highly spicy and sweet and salty meat, and then it comes with a package of salt to add to it sometimes. And I think that's very harmful to your system. Not because it tastes good, that means that you should eat it. Support a very, I would say, famous cardiologist who at one point in time said to his listening audience, as he gave a lecture, he said, if it tastes good, cook it out. And not to be facetious, I mean, I love seasoned food and so forth. But, the taste on your tongue is not what really matters. The kidneys and the other organs are the ones that really register that damage over time. Okay? And that's the emphasis. Over time, these processes take place. Not overnight. That's why most kids are fine. They don't suffer from heart disease at the age of 10, 12, 14. And then in the 20s and 30s, then they start becoming symptomatic. But it didn't start, as they started to work or they started to go to a particular place to buy food or live a certain lifestyle. It started when they were young kids. So we need to be able to address this thing. And I think the government has done that. The council has done that, addressing healthy eating styles and diets in schools, and particularly in primary schools, where you can more control what kids eat than probably when they get into high school. Okay, as guardians and parents, you can you decide what goes into the lunch kit. So you can choose a healthy snack for them. You can, you're the one that's buying it. They can't dictate to you what you should buy in the supermarket. So you're the one that you're in control at least for the first decade of their life. Easy, dietary wise, and to also encourage, before I forget, the role of exercise, daily exercise, at least 20 to 30 minutes, 5 days a week of moderate exercise. That's probably 150 minutes. Or if you're doing vigorous exercise, maybe about 75 minutes a week. Okay, so if possible, if you have no disabilities, then you get that in. Walking, running if you can, swimming. I strongly advocate swimming. Is a very good cardiovascular.
Okay. Thank you very much, Dr. Sylvester, for sharing this information with us here on World Heart Day on Doctor and Cole. And we would like to have you back at some point in time so that we can continue this discussion. So thank you once again for joining us this evening here on GBN.
My pleasure. Thank you for having me. Good night to all.
And we've been speaking there to Dr. Johansen Sylvester, who is a general practitioner at the St. George's University, and we spoke about health issues and conditions and risk factors affecting the heart, and we did that today, the 29th of September, being observed as World Heart Day. And the theme, use heart for society, your loved ones, and you. And that is the message being promoted this year. Thank you once again for joining us here on Doctor and Cole.
Drug abuse, cancer,
measles, diabetes, AIDS, cancer,